Good afternoon, and thank you for joining us. We will be practicing some good social distancing modeling here today between Allie Worcester and myself. So I'm Jim Jarvis. I am the Senior Physician Executive for Northern Lights Incident Command in response to the COVID pandemic. I have a few messages to give to you guys, and then Allie has a brief statement, and then we'll open it up for questions. So first and foremost was that we were informed today that Northern Light Blue Hill Hospital had their first positive inpatient case of COVID-19. I will not go into any details on that particular individual for their concern and their privacy, but I will say that the staff are doing the things that are appropriate in management of that particular individual and in taking care of themselves and remaining safe. I do want to just give a little brief update about the COVID-19 situation here in Maine. We continue to see numbers rise, both in the number of cases of positive individuals and the number of deaths in our state. I will say that there has been some concern raised that the public may think that these numbers are low and therefore do not need to follow the governor's direction of staying at home. I will remind people that the reason why our numbers are low in the state is because we are only testing certain individuals, those who are inpatients, those who are first responders or healthcare workers, and then those who live in congregate living situations such as long-term care facilities or shelters. And so that's the reason why our numbers look low, because we are not testing the general population. But we do know that community spread, particularly in the southern part of the state, is on the rise, and we started to see community spread in other counties within the state of Maine. And so it is extremely important that we remain vigilant, that we stay home unless we have to do essential needs like go grocery shopping or to visit your healthcare provider, that we maintain our social distancing, good hand hygiene, and good cough and sneeze etiquette. And now I'll turn it over to Allie.
Hi, we just wanted to share that one of the most important things on our radar right now is keeping our staff safe. We can't provide the care that we need to provide to our community unless our staff are safe and ready to care for patients when they arrive. Part of the way that we're doing that is by restricting visitors to the medical center, and we have a rigorous screening process in place for both visitors and staff that enter the medical center. They have to go through these locations in order to get into work every day, and we check in with them on their health on a day-to-day basis. We're also rolling out support for staff members from an emotional standpoint to make sure that they have the support around them when they need it.
And now we'll open it up for questions.
Okay, as we mentioned at the beginning, there's time for 2 questions from each media organization. If you know who you'd like to direct your question to, if you can let us know when you ask it, that will help then more quickly get the video in on the first answer. So we'll start with WABI. Anna.
Hi. Yes, thank you. I think my question is directed towards Allie. If she can't answer it, then maybe Dr. Jarvis can. Allie, a picture was sent to me from somebody that works at, I believe, Northern Light Health, about how nurses there, they're only allowed to use 1 mask per day, and that they're having to save these masks and use them the next day. And they're being put into like a paper bag and saved the next day. How is that, if this is true, how is that protecting them if they're using the same mask day to day?
Sure,
that's true.
Sure, that's a great question. We have provided masks to all of our staff that come within 6 feet of patients or within 6 feet of other staff members. This is above and beyond the CDC recommendations at this point, but we're trying to do it to slow the spread within our community and within our healthcare system. As you know, there is a national shortage of masks. And part of our approach to this is to look at it from a professional and prudent standpoint. We recommend that our staff members wear their masks and take care of their masks in a way that helps to preserve that stockpile. We absolutely have masks available if the mask becomes compromised, whether it's wet or soiled or dirty, they can come in and get a new one. We're going to rely on the professional knowledge of our staff members to know when to do that. But we did give them paper bags to put their masks in when they take them off for eating or drinking or in between meetings, in a way that they can keep them in a sanitized and not on a table. The paper bag also helps the mask to aerate and dry out when they have it in there. This is a process that our infection prevention and epidemiologists have looked at, and they've looked at it on a national scale as a best practice to try and preserve and extend our stockpile of masks.
Are they getting a new mask every day?
They can get a new mask whenever they determine that they need a new mask.
Okay, thank you.
Okay, next we have main public, Patty. Oh, sorry. Go ahead, Patty.
Oh, sorry. Hi, I think this is probably a question for Dr. Jarvis. I'm curious what you need most right now. There's a lot of, equipment in short supply. So is it the PPE? Is it, more staff like respiratory therapists? Is it more testing? What do you need most right now?
So most what we need is for the general public to follow the guidelines and rules that we've set in place. So doing social distancing, staying at home, washing their hands, and keeping themselves safe and well would be the single best thing we can do to decrease the amount of usage of the medical center and the healthcare professions in general. In addition to that, yes, we continue to be concerned about the supply chain for things like our personal protective equipment. And so we continue to work on a daily basis to improve the stockpile that we have and to find other avenues to continue to have the resources that we need. My long-term concern is that if we start seeing an increase in numbers of patients with symptoms, and then those that have severe symptoms require hospitalization, or worse yet, require critical care, I am concerned across the state about the resources that we have in terms of hospital beds, ventilators, and staff. But right now, Northern Light Health is coordinating with other healthcare agencies across the state and with the state itself in order to prepare for what we call the surge, or the large increase in patients, and the things that we can do to keep our community safe.
Thanks. And then also Dr. Shaw announced today that the state is going to be getting some of those rapid tests from Abbott. I know those are going to be used outside the hospital, but still just boosting that testing capacity. I'm curious what your reaction is to that and how much it's going to help you.
So I'll be honest, I did not hear Dr. Shaw's report today, but I did see that Maine was looking to get some of those rapid tests. I will tell you that Northern Light Health has the ability to do tests with its in-house lab, and that has been a game changer for us. What was taking days to get test results back now takes hours. It has helped us to take care of our inpatients, and it's helped us to take care of our healthcare workers and first responders by being able to test them, and when their test is negative, get them back out to work as soon as possible. And so those have been advantages for us. At the current time, Northern Light Health is not pursuing that rapid test because we feel the accuracy of the test that we have in-house and the timeliness that we can get those results are suiting our needs, but we will continue to evaluate that as time goes on. From purely a scientific and epidemiologic standpoint, it would be wonderful if we could test more individuals because that would help us to know exactly where we're talking about community spread being right now in our state, and would also help us as we ask the federal government and other agencies for assistance. But right now we just can't do that, and so we will continue to do the things that we're doing now, which are appropriate.
That would be me. Dr. Jarvis, I hope I'm not asking a question that's already been answered, but why are you only testing the first tier patients? Does that have to do with the shortage of tests, or are you trying to protect your staff?
So it's for two reasons. First is not just the shortage of tests, but also the ability to run the tests. So when we were using the state lab almost exclusively, the state just simply got backed up on being able to run tests, and so it was taking days or longer to get results back on patients that were critically ill, and we needed to know that information now. We continue to use that same tiered process in order to keep that ability for us to, one, take care of the patients that are the sickest, and two, like I said, protect our healthcare workers and our first responders. If we're not here for the community, that serves no one. And so it is important that we be able to know whether or not our first responders or our healthcare workers are positive with the disease, because if they just simply have a cold, we can return them to work much sooner than if they were infected with COVID-19. And so that's the reason why and rationale that we do that. For the same reason is why we're testing people in congregate living areas like long-term care facilities and shelters, because an outbreak in one of those facilities will cause those patients most likely to need to seek care at one of our hospitals. And if we fill our hospitals up now, we will not be prepared for when we have those large outbreaks that we expect to be coming in the coming weeks.
My second question is, you said that at your drive-up testing centers, you're doing physical assessment rather than testing. And I'm wondering, what is that?
So I want to be clear, we're actually doing both at our drive-by facilities. So we are referring people to get tested there. The majority of the people being tested are first responders and healthcare workers at this time, though there are some other individuals like those that may be living in a shelter or a group home that we be sent there as well. But we're also providing a service to be able to do some basic assessment for patients who are having respiratory symptoms, who we feel need to have more than just the triage line's advice for home care. We're doing that because we want to keep individuals who may be infected with COVID-19 away from our emergency rooms, our walk-in cares, urgent cares, and our clinics. Why? Because those are where we have individuals who are immunocompromised or otherwise susceptible to this virus and may have more severe consequences than the mild symptoms the overwhelming majority of individuals have. And so this is a safety issue that we're dealing with, and it's actually to protect our patients, their family members, and our staff. We do hope that we will actually be able to expand our capabilities and be able to do more than just a basic routine exam and assessment at those facilities, and there will be more to come on that during the coming week and month.
Thank you.
Mm-hmm. Thank you.
All right, next we have New Center, Maine, Paul.
Hey, doctor, can you hear me?
I can.
I missed the very beginning of your opening statement, but did it have something to do with the Blue Hill Hospital?
Right, so we were alerted this morning that an inpatient at Blue Hill Hospital tested positive for COVID-19. We are caring for that individual, and we are working to protect our staff and the other patients in that facility to make sure that everybody is treated well and remains well.
That was the first case there?
That is correct.
Okay. And my second question was, so down the road, say for instance we reach the peak and our numbers start going down, we're all over. How would just 2 more people coming into our communities that start spreading the disease again, how are we going to be able to stop it from happening down the road again? Will we have antibodies built up and we're able to ward it off? Are you building vaccines and stuff that would help with that?
So unfortunately, we don't know the answer to the question is, if you've been infected with COVID-19, can you get it again? We do not know because this is the first time we've seen this virus. And so it will take some time for us to know what happens with the course of the virus, both in the standpoint of community spread and then within each individual. So more to come on that. There are companies right now who are working on vaccines for this particular virus. The earliest time frame that I could see that being available is probably 9 months from now, probably even longer though. Typically it takes multiple years for a vaccine to go from start of development to being able to use safely in human beings. We do know that that process has been sped up by a number of companies, including one that thinks that they can begin doing human trials in as early as the fall, which would be a remarkable turnaround time, but still we're talking months away, possibly years away before we have a credible vaccine that can protect us, which is again the reason why we have to be diligent and remain using social distancing and not venturing out unless it's for necessary reasons like getting health care or buying groceries or other things to sustain you and your family.
News, Isha.
Hi, can you hear me?
I can. Go ahead.
So my question, I was going to ask about the rapid response test, but you mentioned that Northern Light is currently not expecting any of those to be at the hospital. Is that correct?
That's correct. We are currently not pursuing that test. We are looking into it, but right now we feel that we have one of the most accurate tests available. We have the resources to run that test, and we know we have the resources to run that test for quite some time going forward. And we also feel the turnaround time for the test that we run in-house is adequate for our needs currently. And so we are very happy and pleased. We are a lucky community that we have the facility that we have, that we're able to do that test in-house. Most hospitals need to send their tests out to another company or to the state to be run. Because we don't need to do that, it actually makes our turnaround time a lot faster across the Northern Light facilities.
Do you have numbers on how many patients, like on an average estimate, do you test daily at the in-house testing?
So we actually have we are testing approximately 100 to 150 individuals per day at this time, about 1,000 per week.
Okay, thank you. Do I have a chance for one more question?
Go right ahead.
Okay. So I know that one of the cardiac units was converted into the COVID-19 unit. Can you tell me how big it is in terms of both staffing and patients?
So capacity on that floor is around 32 patients. I can't tell you the exact number of staffing, but it is staffed the way that we would staff any other medical surgical floor in our facility with the same staffing ratios. We did this because we wanted to make sure that we did not intermingle patients who are suspected to have COVID-19 with those individuals who are not. And so cohorting helps us to do two things. It helps to keep all the visitors and patients within our facility safe. It helps to protect our staff as well. It also helps to protect our resources as far as personal protective equipment, because when we cohort these patients, we don't need to reuse equipment quite as often or change over equipment as often as we would if we had them spread throughout the facility. So this is really best practice, and is a process that we would put in place if we had an overwhelming number of patients infected with influenza or some other communicable disease where spread is likely. And so we did this as a matter of concern and also as a matter of safety.